right, folks. Dr. Ben here. Welcome to the Dr. Ben and Friends podcast. We have honorary surgeon Dr. John with us today. So, mental health expert and another mental health expert in a similar field, Dr. Brian, child and adolescent psychiatrist. We're going to play the Dr. Ben Buzz Battle. Ben Buzz Battle, B3, like the vitamin we never needed. Where a professional comic suits up for surgery to beat the clock and save the patient. We're serious all day long. When you're with Dr. Ben and Friends, you can decompress. And whether that's at a stand-up comedy show or our podcast. Dr. Brian, how about we have Dr. John take over as surgeon today? Dr. John, have you ever had thoughts or aspirations of being a surgeon?
No way. No.
He's got the look, though. I mean, you should consider
feels right. It feels right. And it looks simple. So it feels like you're always telling me how hard this is. It looks pretty easy.
This is the advanced one.
Yeah.
Like real surgery is much easier.
Much easier than this.
And Dr. Brian did a surgical rotation during his medical training. And then what is all this garb that Dr. John has? Why is he wearing all this?
Well, it's supposed to be sterile, but I've seen him break the sterile field 3 or 4 times since he's been here.
Exactly.
As a med student, I never broke the sterile field.
Never.
Although, actually, you were telling us off camera there was a time you wiped your brow.
I mean, it was fairly sterile still, though, yeah. I mean, a few coughs here and there is not going to do anything.
As a regular student who didn't go to med school, I've never heard the phrase sterile field, so I'm glad that there is one. That sounds like a thing I would want if I was getting surgery.
Yeah, I learned that 30 seconds into my first rotation with the eyebrow row.
Usually in blue, that where everything's sterilized, and so...
this color matters?
Yes, usually we tell the students everything in blue, don't touch. Stay back with about 3 feet of what's called the sterile field, meaning when we prep and drape the patient sterilely and the instrument table has all been sterilized, so no one that's not sterile can touch it.
Wow.
So we have Dr. John, and we'll say today sterile gloves. They sterilize gloves. They sterilize gowns, which is kind of like a strike zone from here to here, we say is sterile. So you can't be fidgeting with your collar. And
I showered on Wednesday, so that was just 4 days ago, so I feel like I'm pretty sterile.
Fairly clean.
Yeah.
So it's better than a lot of my patients. We have a bouffant cap that you might find in the cafeteria also, but to keep the hair out of the patient.
I just put this on because it made me feel beautiful. It's good.
And a mask in case you feel the urge to sneeze. All right. So
that never occurred to me that you're just doing a knee surgery and you're just like, oh shit.
Right.
That never even crossed my mind that would happen.
And if you do feel the urge, you actually kind of want to face the direction, believe it or not, and not turn, because you're less likely to contaminate something if you're facing with the mask, as opposed to if I want to turn away from the field, then I'm exposing more of the air coming out from a sneeze out the side. So
I did not know that.
If you feel the need to sneeze, just
I'll do it right on my patient here.
All right. Well, Dr. John's going to have 60 seconds to cure our patient of any ailments. And if he touches the sides, that'll happen. Then move on to the next one, Dr. John.
Okay.
And so before each surgery, we have to perform a timeout, make sure we have the correct patient and correct surgeon, and we're doing the correct procedure here. Pick a name here for our patient today, Dr. John. All right.
Scooter, slide, and splatter.
All right. That's the injury. And then we have a... okay.
We don't have the names. This is Stan, because he is substantial.
Substantial.
Yes.
All right, Stan. We have Stan here for 12 ailments for Dr. John to fix. Don't start yet till the timer starts, and you'll have 60 seconds to cure Stan of all his ailments, such as a frog in the throat and butterflies in the stomach. Okay, wait for the timer, Dr. John. All right, Dr. Brian.
Let's what's he starting with? Is that a duck?
It might be
duck in the elbow.
Yes. All right. Look at him go with the...
A bird in the hand. Maybe that's what's supposed to be.
Oh, bird in the hand is worth 2 in the bush.
Now that stuff.
Dr.
That's...
John, look
he's moving.
Dr. Eats. Surgeon wannabe here.
He is removing...
mushroom? In the... Oh, toe fungus.
Toe fungus.
Toe fungus.
Yeah.
I like it. Wow, look at
Okay,
he's trying to go for the record
He's
here.
moving.
He's not competitive or anything.
Is that the
Going for the
tibia?
record. Oh, humorous. Funny bone. All right, Dr. John's removing. Look at him go.
Okay.
Got the frog in his
Oh, we
throat.
forgot to name that guy. I mean, you're not even operating on the right one now. That's
Now, what's with the teddy bear? That's got to be a play on words. Bear. Okay. All right. Wow, look at the precision of a surgeon here. All right. Good job, doctor. You saved him. You saved him. Okay, count up how many ailments here.
1, 2, 3, 4, 5, 6.
All right.
What's the record?
It's our best.
I won
today. Today you're
you're in first place
today.
right now.
first place today.
Yes. I need this. I need this.
The record I think is either 6 or 7. 6, 7. Okay. But good job, Dr. John.
So what was it like?
What's that?
What was it like?
What was it
The
like?
surgical experience.
Oh,
Tell us about your first surgical experience.
I think it's so much easier than trying to help a family system and navigate neurochemistry and support networks.
That's
Not
A
to complain.
plus. He didn't even yell at anesthesia. Like,
Right.
Yeah.
To adjust the height
Well,
of
it's
the bed.
not my pain. It's the pain is Stan's problem. I don't need more anesthesia.
Yeah, we like to ask anesthesia to adjust the height of the table or, keep the patient from moving.
Oh, can I
Just
ask
a
you
witty
an
banner.
anesthesia question?
Please do. Please do.
I should know this since I'm an obviously
Surgeon.
skilled surgeon. Okay. I'm in my mid to late 40s now. I had a colonoscopy a year and a half ago. First one. It's not as exciting as I thought it was going
As
to
it
be.
sounds. Sounds like riveting.
Okay, but the first thing when I woke up, I've had multiple surgeries. I've been a clumsy, kinetic idiot most of my life. But that was the first time I ever took propofol. And I opened my eyes, and the first thing I said to my wife was, "That's the greatest thing ever."
Oh, yes.
What is different about propofol than all the other anesthesias I've ever had? Because it felt like I didn't wake up that groggy. I felt like
Right.
I'd had the greatest, and they said I was under 20 minutes or something. That was a great.
That's the best nap.
It felt like I'd had a whole night's sleep like I haven't had since I
very
started
restful.
having kids. Yeah.
And that's common. So we hear that, and that's the medication that Michael Jackson
No,
was taking.
I didn't want to say that, but
Right. But it needs to be monitored,
well, I
which
said
he wasn't.
I absolutely get Michael Jackson
you
now. That's what I told
understand.
her because I was like, that
Great,
was
restful,
magic.
peaceful
Yeah.
sleep. And they're getting now with that's probably the latest, but the cleaner and cleaner medications. We've come a long way from the chloroform and ether days, so less side effects. You feel very rested.
But why is that so much better? Is it chemically unique? Is it
right? I think it's
Just a
chemically.
different drug?
I'm not
Okay.
an anesthesiologist.
Okay.
But yeah, it's a very common the feedback we get from colonoscopy because that's the only medicine you're getting are just the
Okay.
propofol
okay?
and not other. But yeah, it's just very clean, neat. It's definitely needs to be you were monitored.
I'm
during that,
doing colonoscopies weekly now. That's awesome.
Just for that sleep.
just for the sleep.
hey, can I get another
I'll
colonoscopy?
trade the camera, the inconvenience for
or that go
for
lightly
the night
the
of
prep
sleep.
you had to drink.
Oh yeah,
That was fun.
That was not great. Well, I got this old school, and my buddy who's a physician was like, "Oh, they don't do that anymore." And I had like this jug I had to drink out of.
Go lightly or
I don't know
Something.
what it was, but he said, "No, man, now they just give you a couple of smaller things and drink that." And I was like, "Well, I think my people are having fun with me,
Jug.
man, because it cost me a night of my life."
oh yeah, you're sitting on the porcelain bus.
That's right, cleaning out the system.
I think technology, though, for GI, I'm not a GI specialist, but who knows? Maybe we'll just have a special scan or we're kind of, some of them you can swallow a camera. And that takes pictures for you. Or I bet there's
That'd be
probably going
wild.
to be some like lab marker that will be able to tell whether or not you have precancerous lesions or so. It's amazing, the technology. Do you think technology will ever take over for comedians? Will they be able to write better jokes and elicit laughter better than humans?
I was talking to a really well-known comic recently, and who said he just put into ChatGPT, "Write me 5 jokes in the voice of," and he said I couldn't tell the difference.
Wow.
And so the joke writing, I think, is But there's a whole bunch of really amazing writers. I think it's, can you create an environment? Can you deliver it? Can you be with an audience like that? That's pretty tough, I think.
Yep. All right.